Thank you, Mr. Chair. House Bill 1901, just talking about eligibility changes. I'd like to start out first by saying I think sometimes we forget what other states are doing, and it's important to look at those. But you know, Governor Rick Perry of Texas asked for a waiver to increase eligibility to 185% of the federal poverty level. Presidential nominee, and I believe is going to run for president again on the Republican ticket. You have Michigan, who's passed Medicaid reforms with expansion. Nevada, New Jersey, New Mexico, North Dakota. Pennsylvania is about to. Ohio is going to. All Republican governors. And I leave, last but not least, Iowa with a Republican governor as well. And I say that because a lot of the language from 1901 has been adopted from there. And the eligibility requirements are the same as Iowa. Going up to 100%, the federal poverty level, and then going to the exchange, 101 to 138. I think it's important to look at the policy. I mean, by independent organizations, that this House bill has been called the most conservative Medicaid reform expansion bill in the country. There's a reason for that, because there are so many reforms in there. And I truly believe the eligibility changes and reforms are linked together if we truly want to get something passed this year or down the road.
This has been kind of a difficult issue for our members over the years. We don't support federal mandates in the healthcare system, nor did we support passage of the Affordable Care Act or Obamacare in 2009 and 2010. However, it's law, and we're faced with two options. We can either hope and wish that it just goes away, or we can try to craft a more pragmatic approach to dealing with the issue and hopefully craft a Missouri solution to what is basically a Washington, D.C. problem. We think that House Bill 1901 is that solution to the problems caused by Obamacare. There are a number of specific reasons why we are in support of this legislation. First and foremost is the fact that with passage of this bill, $2.2 billion a year will come to Missouri and will be injected into the federal economy. And regardless of what you think about Keynesian economics, and I'm not a huge fan myself, I would suspect that not a ton of you are either, but that's $2.2 billion that we have streaming through Missouri's economy that wouldn't be here, or that won't be here if we don't pass 1901. Secondly, dish payments are going away for hospitals, but yet sick people aren't. And a lot of sick folks are still going to be presenting themselves in emergency departments around the state, and hospitals are going to have to recoup those costs one way or another. It's likely to be on the back of employers who provide insurance to their employees or the privately insured. A third reason is, just beyond the economic or beyond the social and humanitarian benefit of having 300,000 more people with health insurance. These people, as Representative Kelly alluded to earlier, are working, and a healthy employee is a more productive employee and one who doesn't lose a lot of time to 6 days. We also share Representative Kelly's concern about the effect on the rural economy if hospitals in rural areas are forced to lay off their employees or reduce services or even go away. As he mentioned, and we completely agree, hospitals are the biggest employer or close to the biggest employer in a lot of rural areas. We've seen job losses and layoffs from hospitals throughout the state. BJC, SSM, Mercy, Ozark Medical in West Plains, Nevada Regional, Liberty Hospital all had layoffs, over 1,000 this past year, and there's likely more to come. This is not good for rural economies who really depend on having the hospitals there as an economic engine. And along those lines, 4 of the states bordering Missouri are expanding Medicaid: Iowa, Illinois, Kentucky, and Arkansas. And geographically, obviously, that covers approximately 3/4 of our borders. The states that are expanding Medicaid are going to have a much stronger healthcare infrastructure. Their systems are going to have a lot more money, and they're going to be in a position where they can poach our primary care providers, both docs and nurse practitioners and nurses, away from our hospitals, especially rural areas, And as we all know, there's a shortage of primary care providers as already. We certainly don't need lessening of that profession. And finally, Jackson Hewitt has estimated that the potential liability from penalties from the Affordable Care Act to employers in Missouri is between $35 and $50 million a year. And a lot of businesses in this state operate on pretty thin margins. And when you're looking at facing a $2,000 to $3,000 penalty for each employee you have, if we don't do Medicaid expansion, that might just be the tipping point to make you shut your doors. And so we think there's an incredibly compelling business and economic case for Medicaid transformation, reform, and increase in Mo Health Net eligibility, which is why we support House Bill 1901.